Hey guys, welcome to another potential lecture from Dr.Allen at Dr.Allen LA. Today's subject is going to clearly be about things that I think is very important. One is the multi-inflammatory system in children, and the second one is going to be the access to the possible second COVID vaccine. As you know, some of us saw the story part of which I talked to the Department of Health, Dr. Ferrer and Dr. Balter. These two individuals are leading LA County, which is from our public health department, on the things that are going and regulations that are in place. Let me currently let you have access to some of the conversation. Remember, all of it is not for public use, but I think there's some important questions that I ask that I think you should know about.
This is Dr. Allen. I actually own 7 area cares throughout the Los Angeles area. My first, I have actually 2-part question. One for Dr. Ferrer, probably for Dr. Balter. The first question, Dr. Ferrer, is with this group that we're speaking with today, is there a true realistic time of not only the first vaccine, which is what they're asking for at this particular time, will they have a fall effective within the time frame here for the second vaccine? Dr. Balter, that this also had a discipline club today in that county who were concerned about the multi-inflammatory system. The families are wondering now that the kids going back to school, what is the county or what is our direction now in making sure that the children don't progress in the process and or even the teachers are having so they can ensure some safety as well. So I believe 3 comments on that.
So, if you didn't understand it, maybe from the speaker standpoint, the first question I asked about was multi-inflammatory system in children, and the second question I asked about was access to the second vaccine. Let me give you an example real quick of what is multi-inflammatory syndrome in children. For those of you who don't understand, multi-inflammatory syndrome in children is linked to the association or linked to the coronavirus, which is how it's starting now in our kids. It can affect the children's heart, lung, blood vessels, kidney, digestive system, brain, skin, and eyes. And it becomes very severe in some cases, even causing death. Again, emphasizing multisystem inflammatory in children seems to occur weeks after COVID-19 infection. So after your child develops COVID-19, maybe doing extremely well, 2 to 4 weeks after, the baby can develop multi-inflammatory syndrome. This is what you will look for. Fever that lasts for more than 24 hours. Now, my population clearly knows this is normality for us. Fever lasting 24 hours or longer, vomiting, diarrhea, stomach pain, any type of unexplained skin rash. The child just seems to be tired a lot. Feels like his heart or her heart is beating fast. Difficulty breathing, or especially respiratory symptoms associated like with asthma. Red eyes, which you may get confused with pink eye. Swollen lips and tongue. Swelling around the hand and feet. You may think hand, foot, and mouth disease. Headaches, dizziness, or enlarged lymph nodes. These are severe symptoms which would be stomach pain and difficulty breathing. Now I want to say this quickly. In the next couple of months, that's most of the presentation for the kids. Most of the kids that comes to the urgent care vomiting, fever, not eating, respiratory problem, difficulty at night, and some unexplained rash. It's very important, even if your child has not tested for COVID, that you be aware of the symptoms this season and not allow yourself to do the Tylenol and ibuprofen too long if you're concerned about your child. Now, for the healthcare providers, it's important that you look out for it a little bit more diligent than before. It just don't say it's just a normal viral illness. Be very aware of multi-inflammatory system in children because it has risen. Now, from the talk with the public health department, remember I asked about that question. I was told that the increase in California, and I'm not sure about where you live, was due to the increased surge of all of the virus over the holiday, December, Christmas, Super Bowl. And because we saw an increase in the surge, then of course we're going to see an increase in the illness. However, there will be an increase again around flu season for us in California. Now, in Texas and other locations, it's already cold and flu. Here, California won't get it until March or mid-March because that's when COVID hit us last year. It's the increased surge. You want to look for that, and we're specifically talking about this illness as it affects our children. As we move forward, what you're going to know, how do we treat this? This is treated with IV fluids, oxygen. The kid may need blood pressure medication, the breathing machine. Remember, ventilator. COVID usually put people on the ventilator, but here it shuts down your lungs. You want to also be aware of a few things as we move forward. When I go to my doctor, there's a few things that I think is important that you let your provider know. You want to let your doctor know, has the child had any bluish lips, any type of seizure activity, difficulty waking up or staying awake. Remember, those are important things. Let your doctor know. You want to remember the cause of multisystem inflammatory, COVID related. Here's a real catcher. In the United States, it's more prevalent in Black and Latino children. Black and Latino children. So providers, be on high alert for Black and Latino children. Mothers and fathers that have this nationality, be on high alert. Everything this year is not fever, vomiting, diarrhea, and stomach pain. Be on high alert of multi-inflammatory system failure because it is deadly. The medication, and ultimately, let me just add one other thing. The ages 3 to 12, peak around 8. But any child 3 to 12, vomiting, fever, diarrhea, confused, fever that can't stop, please get the child evaluated. Do not. And when I asked the public health, remember I did talk to these individuals. These children, they're allowing you to keep your kid at home this year for the ones that are doing in class. They're allowing you to keep the kids at home if the kids are sick because they just don't want this to spread to anyone else. Again, you want to make sure that when it comes to treatment, antibiotic therapy, steroid therapy, and IV medication, along with a situation called ECMO. ECMO actually does the work for the heart and lungs, or for the kids when they get real seriously ill. They're also doing immunoglobulin, and some are getting other medication like blood thinners such as heparin. That's very important to know that it can get that sick, and you want to be aware of some of the other elements, again, necessary for treatment. Here's what you want to do when your child goes back to school. This is very important. Do not assume that the young kids are going to follow all the rules. Do not assume that. Do not assume that if your child is doing in-class school, that all the guidelines are going to be followed. In this category of prevention, I want you to be aware. Remind your kid, and some parents are real good in putting hand sanitizers in the bags. Keep your hands clean. Avoid people who are sick. Parents, if your children are sick, do not send them to school. Do not. And if you are sick, try to keep your babies away from anyone that has possible COVID, because this is on the rise and it is deadly, and all the media is talking about it. And if you're just hearing about this, that's a problem. Practice social distances. You know, in class, they're hard to one of the main reasons, or the biggest fight about from the teachers union in terms of sending these kids back to school is the ability to keep at least 6 feet. That's hard to maintain in public schools when the classroom size are smaller. And so now some of the argument is to make it 3 feet or 2 feet, but it's hard to maintain 6 feet in school programs. However, you want to make sure you practice and try to teach your kids to practice social distance. Face masks in public settings. Remember, it's important that the kids wear their masks. Avoid touching their eyes, nose, and mouth. Now, it's very hard, especially in young kids, to do this, but it's important that we encourage them to especially around sick kids, to don't do that, or when they're sick. Cover their mouth when they cough or when they sneeze. Parents, this is for you guys. In school or at home, clean and disinfect areas which they've been exposed, high areas of possible transmission. And definitely when these kids come home or after playing, wash their clothing, trying to keep the COVID virus down. Remember, it's very important. Multi-inflammatory syndrome in children is linked to COVID, and it is a deadly illness, and it's affecting the children. You have to be aware that COVID does affect kids, and when it does affect kids, it's 2 to 4 weeks after the illness, leading to an organ shutdown and possible death. I asked about that question, and I was told that the surge happened, or the increase happened, at least in LA County, and which is what we specifically spoke about, because of the increase in the actual illness of our population. But I'm sure that's global. The unfortunate part is we will be getting another potential flu or surge in the next couple of months, as they're saying the UK variant now is going to become the predominant one by March, which is March 1st. So that's why we immediately jumped out and trying to bring this to your attention. Your child is sick, keep your child at home. Your child has any possible vomiting, uncontrolled fever, see the physician. Let the doctors know if the child's been around anybody with COVID or the child has had COVID. And do your best to make sure that if your child is doing in-class or teaching or studies, that we follow some of the guidelines. Now, my second question I asked the Department of Health was, when or how soon should you expect your second COVID vaccine, given the turnaround time and the access to vaccines now? Remember, this is specifically for my LA County population. Now, as you know, I'm going to bring you here. Massachusetts Urgent Care counsels about 6,000 plus people. Why? The individual second shot, they had to cancel because the state had cut off the supply. Massachusetts canceled 6,000 appointments for individual second shot, noting the state cut off its supply. Your second vaccine in the mass population is going to be difficult. Remember, I'm going to be part of the vaccine process, not helping, but giving the vaccine, having access to the vaccine. Your second vaccine is going to be difficult. Why is that important, and what's going on now? The reason that's becoming an issue now is that everybody now is trying to jump on board. But before I go to that, I want to give you another couple of things I want you to be aware of. The first thing is, if you have obesity, there's twice the chance that you're going to die from COVID. Again, let me say that. If you have obesity, you have twice the likelihood of dying from COVID. And obesity is described as a body index of 30% or more. If you have obesity, there's 2 times the likelihood that you're going to be hospitalized and die from COVID. They're saying that the increase in fat cells increase the immune system, and thus the reason that you have a bad outcome. Remember, with everything being stay at home, it's easy to start eating, not exercising. Obesity, you twice the chance of dying from COVID. Remember, this talk is early as our flu season is coming up here in LA, and others is already snowing. Another thing, LA had a big fuss about people jumping the line and taking numbers. I don't think they knew that people who smoke are prioritized to get the COVID-19 vaccine in any category. So let's say you're 65 and older and you smoke, you jump the line. You're a healthcare provider and you smoke, you jump the line. If you smoke and that's your only risk factor, you actually have access prior to getting the vaccine than anyone else. Because the CDC has said that chronic smokers or addicted smoking have a high chance of dying from COVID. So smokers, like it or not, are jumping the line, irrespective to some of the other categories or criteria. So if you see people that's marking that, you have to know that that's just part of the CDC guidelines. Now we're going to talk about what's going on. Since we're having trouble with the second shot, the first shot, which is Pfizer and Moderna, are starting to come back and say, well, Pfizer vaccine can reduce transmission after 1 dose, a new study. Now this is February 26, updated February 27. Pfizer is saying, hey, well, my 1 dose reduces transmission. It does about 37%, up to 50% max. But they had to tell you something because it's difficult now for you to get your second vaccine. However, for those that keeping up, Johnson & Johnson just came out with its 1 vaccine. Just announced Johnson & Johnson was approved. We talked about this our last lecture. Is approved for 1 shot. Now, Johnson & Johnson is a DNA vaccine. We won't get into the technicalities, but this is DNA usually requiring 1 vaccine, and this is RNA requiring 2 vaccines or 2 injections. So this one is 1 injection, up to 60% effective overall. Up to 66% effective overall. But 2 of the Pfizer's or 2 of the Moderna's is up to 90% and higher effective overall. But since you're having difficulty, my question was to the LA County Health Department, how soon can my population expect to get their second doses after they get their first? And unfortunately, these were great intelligent ladies, and I enjoyed the conversation. But they were only able to speak based on what they had available. It's hard to say because access to the vaccines are now very scarce. We are hearing a lot of things, but right now, 1 vaccine for the general population is kind of realistic. And they're now trying to make that in such a nice way available. Moderna will be saying the same thing soon. The unfortunate thing, as we're trying to get our second vaccine, the places like the Philippines and Taiwan are just now accessing their first vaccine, and we're trying to get our second one to get more of some protection against this virus. Now, lastly, we're going to go into here. Even though COVID is very virulent, each state are now trying to, or now developing their own variant of COVID. So New York has a COVID variant, which is very aggressive and can be more virulent and cause death than initial COVID. California, as we talked about in our last lecture, has its own variant, which is very aggressive and has been very deadly. Matter of fact, since September of last year to January, 47% of the people that passed from COVID variant, California COVID variant, were Latinos, and mostly Latino males. So it's good for the healthcare professional and good for that population to be aware. If you get COVID, you got to be very aggressive in treating these individuals because they have a high likelihood of a bad outcome. Now, lastly, I want to share from the lecture, they've outlined a time frame for vaccinating our children. The time frame for vaccinating our children. The high school kids will start vaccinating falls of next year. So we say in August, September, when school starts, there's the time frame of vaccinating the high school kids. Elementary kids, which is pre-K or children 3 and above, they will start getting vaccinated January or February of 2022. So I hope this information has been useful for you. I was very aggressive to ask questions that I thought was effective. One, the multi-inflammatory system in children, that's deadly, and that's coming up where our kids be aware. 2, a realistic time frame of when we can get our second vaccine, and understanding that for some of us, that's shooting for the stars because the vaccines are low. But I was told that by LA County that there are certain places that are specifically designed for second vaccine doses. Fortunately, it's just a matter of them having access to the information. Now, I want to leave you with something that I think is very personal to me. And one of the main reasons I felt that I should say something and do something. I call on my spiritual warriors and prayer warriors now for something that I think is very important. And this is something I think that we should do as a group. And I think we should do this and we should talk to God in our own way. Not by getting down on our knees and begging, but asking God for something that I think is really, really awful. My heart and my spirit suffers when anyone suffers. That's the problem of being a soldier warrior for God, trying to make a difference. And when I see others suffer, I have to say something. Nigerian families await news of 300 kidnapped schoolgirls. 300 kidnapped schoolgirls. Now, if this is your first time hearing this, I need to update you. As of a week or two ago, and this is just the second one, there was one a week before, gunmen went into public schools and got 300 young girls, preschool and elementary, 300 kids. And they specifically got women, 300 girls. Now, I know we all got our own issues, but it's important that I bring this to the table. 300 babies, of which these individuals took off somewhere. Now, these young babies, urinary, pooping, food, begging for mercy, probably on their menstrual cycle, are kids. And you can only imagine the foolishness of grown people. Now, this is some man's agenda. No different than any revolutionary trying to get some idea of making money and doing wrong. But I say to prayer warriors, or I say to everybody, believe or not, let's let God know that we're not okay. This is not okay. Say something to him, not to the idiot that's doing this, not to the Nigerian government, which seems like they take a loan. But every day these kids are with these idiots. You can only imagine the foolishness, and us turning our head because it's not my child or somebody else's problem is not the way to deal with this. If you feel emotion for these kids, then you tell God, I'm not okay with this. I'm not going to get down and beg and do this. You own the program. It's your house. This is your place. Just like they complain to Dr. Allen when I do wrong about the employees. I'm not okay with this. Say something. Let God know this is not okay. And help these children. Make some choice. You can decide, Father, if these kids are suffering. You have that authority to make a difference. We can cry and preach and beg all we want to, but you can determine the outcome of these babies. And some of us feel the pain and going to make sure that we say something and bring it to the masses. Tell God this is not okay. Tell him, don't beg, help these babies. We don't know what they're going through, but some of us have to have a voice. And I'm sure they're crying for some help. Don't turn your back. Just let him know you're not okay with this. Let these babies go. And if I'm affected, I ask you to let me help as many people as I can. Share the videos. And always, thanks for watching Conversation with Dr. Allen.